Mental and behavioral health is a critical and frequently unaddressed issue in the Hispanic community, and now more steps are being taken to address the disparities that so many families are facing when it comes to getting help. Our Kathy Hernandez has a closer look at the resources available in tonight's Stronger Houston report.
Here at the Harris Center, it's a place where people can come, simply walk in and get help for mental illness. But it's not that easy for some, many in the Hispanic and Latin communities. They face many challenges, including lack of health care, a language barrier, fear over immigration status, or a stigma, a cultural belief that mental illness is a weakness.
We forget to take care of ourselves.
Samantha Tolliver is a wife, mother of 4 children, and small business owner.
It wasn't until I had kids, until they were toddlers, and I would feel myself getting anxious a lot of the times.
Tolliver suffered from anxiety, depression, and a condition called depersonalization, derealization syndrome.
Basically, it's where you kind of zone out, like you feel like you're in a dream, like the whole day.
That year, Tolliver sought professional help.
You have to make sure that you are taking care of yourself mentally just as much as physically.
But that's not the case in most Hispanic and Latin communities. According to the Substance Abuse and Mental Health Services Administration, only 34% of Hispanic adults with mental illness receive treatment each year. That's compared to the U.S. average of 45%.
When you think about the sort of disparities associated with access, it becomes a real challenge because it's only going to get worse if it's untreated.
Dr. Ezamanari Obasi is the founder of the Health Research Institute at the University of Houston.
It could be anywhere from financial challenges that are experienced to lack of insurance coverage, stigma, fear of talking about personal issues.
Another major challenge, a language barrier.
There's not always access to Spanish-speaking therapists.
Veronica Cavazos with the Community Health Network says mental illness is often ignored in Hispanic and Latin homes.
You don't bring it up, it doesn't get talked about.
Because of that, Cavazos says it could be hard to recognize the signs.
It's not until things get too overwhelming that they're not able to function regularly that they finally seek out treatment.
We have 4 outpatient clinics around Harris County. We do have case managers, physicians, therapists who are Spanish speaking as well.
People can seek treatment at places like the Harris Center for Mental Health and IDD. Anna Phillips says it's important for individuals and their loved ones to start a conversation.
What's going on? Is there something that you're feeling that may not have been something you've experienced prior?
Experts hope to change the perception of mental illness.
Understanding that not being okay is perfectly fine.
Tolliver believes speaking up about your struggle is a sign of bravery, not weakness.
If you don't get help, it just kind of spirals because it does affect your whole life.
The main sign of mental illness is you're just not feeling yourself. Those signs could also include that you're crying more often, you have a change in appetite, or there's a lack of energy and motivation. For a list of resources, we've posted those on our website, click2houston.com. Reporting in Northwest Houston, Kathy Hernandez, KPRC 2 News.